Okay, welcome back to our Herbs Point Media channel. We're very excited to have you. And today we have Dr. Linda Mead here with us. And I asked her to come on. We're going to be doing a series here in the near future about weight and how we can lose weight and how we can jumpstart our weight loss. But before we did that, I wanted to just take a moment and kind of give you a little intro piece that commonly I think we all run into. And so I posed Linda this question. I said, one common misconception about weight loss. And so I asked her to join me and maybe just give us this little nugget of information. So I have Dr. Linda Mead here. She's double board certified. I'm going to hopefully get this right in obesity medicine and internal medicine.
Yes, that's right.
Do I have those two? And
Yes.
she runs a thriving practice, Brazos Weight and Wellness. So maybe just hit me real quick on what that is and how you got to this point.
Yeah, so I have actually been an internal medicine doctor and treating patients now for 30 years. And I've always been interested in nutrition and more of the preventative care aspects of this, because when you see internal medicine patients, there's a lot of chronic diseases and chronic illnesses with that. And I really saw that there was some underlying lifestyle things that I think that patients could do that can really help them to improve their health. And so because of this, I wanted to get more information and become more educated about how to do this. And so I went and did another board certification, and now I'm also boarded in obesity medicine.
It's double board certified.
Yeah.
Very good. So, okay, with that little intro, I present to you the question that I presented last week. And I'll tell you, I actually don't know exactly what she's going to tell us here. So one common misconception, and I kind of phrased it, and you can go however you want on this. I said that both maybe it's something the patients have, but then also providers, because I know being around Linda, I've learned a lot of things that I thought I knew were completely wrong. So yeah, go for it. Educate me.
So I think this misconception is across society, frankly. And one of the most common things that I come across is that obesity is due to a lack of willpower, okay? That you can will yourself if you have the discipline and, really to, eat the right things, to physical activity, do those things, and you won't have obesity.
You just overcome it.
Exactly. And this misconception, I think, is across patients, but also for providers too. And I think, thankfully, that there's more of awareness now in terms of the complexity of this, because it's a very complex way that our body has to regulate our weight. And lots of different hormonal and neurochemical processes that can make it hard to really lose this weight. So so I think that is something that we see a lot, and I'm sure that you have maybe seen it personally as well too. Maybe you've come to the doctor, wanted to lose weight, and just have heard, hey, just go home, eat less, exercise more. And we know it just doesn't work.
Just cut out the sweets, right? Why are you eating so many sweets?
Exactly.
Just it's all your fault, right?
And I think that there's some negative things about this, because what it does is it causes stigma, for a lot of patients. And there's a judgment also that's involved with that too. And what this can lead to as a person who's trying to do this is it can cause guilt. And it can cause frustration. It can cause shame as well. And that really sabotages even further discussions about people when you want to try to seek help, because you may not feel like you're heard.
And I'm just sitting here thinking, and truly, I didn't know what you were going to say here. So even within, I have to be confessional here, maybe it kind of ruins a little bit of the patient-provider relationship if as the provider, you say, hey, you know what you need to do? You need to lose weight. And then the patient comes back 6 months later and they haven't lost weight. I have kind of an assumption that they didn't choose to lose weight, right? They didn't make the choice.
That's where that judgment comes in, and that makes it hard. Because, we know actually that obesity is a chronic medical illness. It was classified as that by the American Medical Association in 2013. So it comes with all of those different aspects with the chronic illness, just like diabetes, just like hypertension, just like heart disease. So, when someone comes into my office, they have hypertension or they have diabetes, for instance, I don't say go home and just don't eat sugar, right? We talk about it. We talk about what leads to that. We talk about lifestyle changes. And then we offer medications, because it's a process that's happening in your body that's causing you to lead to that condition.
That makes sense. And I can see that's a great analogy with like hypertension. Clearly, that's something where, yes, we're going to use lots of medicines. We do lots of medicines,
we have
unfortunately.
lots of options, and that's great. And I don't mean to say that, to downplay the medication part. I
but
think
there's
it's
other
just
things they can
another
do too.
tool.
Yeah.
Exactly.
Yes.
Exactly.
Yes.
That is within your control
Yeah.
that you can do to help with this.
That makes sense. So then the other thing I'm just thinking about with this idea of willpower here, I would assume there's a fair amount of mental health issues that patients that are struggling with weight that goes into. If they feel like it's their fault, then that naturally would make me think they lead to other things. Is that a true assessment?
It's true. And there's a lot of things that can affect weight. And I had said, alluded to before, this weight regulation is very complex. And we're just starting to really figure out all the different processes. You know, you have really three main organs. You have your brain, which kind of oversees everything. You've got your gut, and that produces a lot of hormones that communicates to the brain. And you have your fat cells. And a lot of times people don't see the fat cells as an organ, but actually is. It's actually a very, very active endocrine organ system that secretes a lot of different hormones and chemicals and substances that also signal to your brain, gives information to your brain in terms of how much energy we have stored. The brain sees that. It makes a determination whether do I need to store energy, or do I want to burn energy? Do I need to, stimulate appetite, or do I feel like I have enough and I'm full? I don't need to stimulate appetite anymore. So there's a lot of signaling that goes on in terms of the neurons, in terms of the hormones that's in the brain, but also in our gut and also in our fat cells too.
And so I'm sure you're going to get into this in our wellness series, weight loss series, but I'm just sitting here listening to you, and I'm thinking back to about 10 years or so ago when we both worked at a large institution. I was actually the weight loss guy for our area, and I basically just sold the little packets.
Okay.
Yeah. So I patients would come, and I'd tell them, oh, you need to just buy the packet. And,
Yeah.
you would eat the packet. And patients,
You're
some
thinking
did.
about meal replacement.
Yeah, the meal
packets.
replacement
Yeah.
type stuff. So that did help, but I can assure you, I never even knew about half that stuff you're talking about right there as far as these hormonal regulations. And probably that's my fault, but I would imagine there's other providers that are primarily just focused on meal replacement. And I'm sure that's hugely helpful.
It's a very useful tool.
Yeah.
Yes, it's what we call structured eating, okay? And it's nice because it's usually these products are formulated so that you have the right amount of proteins, the right amount of nutrition in terms of vitamins and minerals and all those essential things that you need. And you don't have to think about the calories, right? You don't have to think about what food you want to get, when you're going to eat, all of that. So it makes it nice and it's convenient from that aspect of it.
But that's only one part,
But it's
right?
not,
Yeah.
yes, and it's very effective, but it's not something you can continue the rest of your life.
Yeah.
It's not something you're going to do possibly even a year.
Yeah.
But it's a way that can help people at the beginning to really learn what portion sizes are and to maybe jumpstart things a little bit.
Yeah. So obviously it seems like there's a lot. We talked about one misconception, and I started running in a bunch of ways. I'm sure you guys have lots of questions for Dr. Linda as well. I'm guessing you probably have a lot more to share on all these topics. I would assume,
Yes,
right?
and we're just touching the tip of the iceberg here.
Well, we are really looking forward to our upcoming weight loss. We're calling it a Jumpstart the Weight Loss Journey, and it's really going to be Dr. Linda kind of guiding and sharing with us. I'll be along the way, kind of asking questions as the guest here that really truly doesn't know a lot.
Yeah, I'm looking forward to the discussion and the questions that come up, because these are things that I talk about with patients all the time. So I love sharing this. I love sharing information, and I think it's helpful because then you have some control over what you want to do in terms of your health journey.
So join us. We have a website, herbspoint.com. It's pretty preliminary right now. Also, we have a YouTube channel, Herbs Point. You can go find us. This video will be there. Post your questions. That'll help us kind of know what you guys want to hear about. We clearly have some plans along the way. It's going to be 7 parts. We'll be bringing in some other experts also. But if you have specific questions, we'd love for you to go ahead and start posting those on the video below. And so we'll look forward to seeing y'all very soon.
Looking forward to it.
Thanks.